watching AYV Television.
Good evening, viewers, and welcome to another episode of The Woman's Place, your weekly women's health program, coming to you live on Channel 33 AYV Television. I am your host, Dr. Frances Ramatu-Wuri-Sise, obstetrician gynecologist. Remember that we are currently streaming live on ayvnews.com and that our Facebook page at The Woman's Place is looking forward to receiving your questions and comments. You can also join us on AYV Media Empire's Facebook page, and we'll also be able to take your questions and comments later on in the show. This evening, we are going to be discussing the subject of menopause. Menopause, simply put, signifies the end of a woman's reproductive life. It is an extremely challenging period, not only with regards to the physical changes happening within her body, but also in consideration of the various psychological stresses occurring at this time. As with most topics discussed on this show, it is vital that taboo subjects like menopause are discussed openly and honestly. With me in the studio this evening, I am pleased to welcome Dr. Ima Williams, a practicing GP from Newcastle upon Tyne in the UK. Happy to also mention that she's the commerce graduate. Dr. Williams, please say good evening to our viewers.
Good evening, viewers.
Okay. So like I said, we're going to be discussing the issue of menopause. So let's start, from the beginning. What is menopause?
So menopause, as you rightly say, is the end of a woman's reproductive period. Mm-hmm. And that means that they don't have any periods. Their periods stop, and the woman is not able to reproduce and have
any
babies
longer. Yeah. But when we say if a woman has missed her period 1 or 2 months, we don't really say that it's menopause. No. When can we say it's menopause?
Yes. So menopause would occur. You normally diagnose menopause if a woman hasn't had a period for 12 consecutive months.
Right. But what's important, I guess another issue why we're having this topic is for us to be able to pass on the message that this is a natural part of life. We're not talking about a disease condition, right, Dr. Williams?
Yes, it is. It's natural.
Okay. So why is it important, again, minus highlighting the fact that it's a natural part of life, why is it important that we have this discussion?
Well, menopause can be quite detrimental to a woman's health and to the family as a whole, because people can, because of the way the woman is feeling at the time, that can affect the emotional relationship she has with people around her. Right. But not also that it's not spoken about, so people don't talk about it, and there's a lot of uncertainty about what menopause is. and what the management that's available.
I think that's a very valid point. We want to make sure, as much as we say there are certain subjects that are taboo, but these are one of the things that we should be talking about. And for women who are watching, who are probably going through menopause, it's important that we let them know that they're not alone. This is not a disease condition. And as Dr. Williams has said, this does not only affect the woman, but it definitely affects the people around her. So it's very important that we give them the right information with regards to how to successfully go through this period, because definitely you do come out on the other side, right?
Yes.
Okay. So Dr. Williams, when does it usually occur?
So on average, it occurs when a woman is about 51 years. That's an average.
Okay, 51.
Yes.
Okay.
But depending on the race and ethnicity, that could be earlier or a bit later.
Okay. So when you say earlier or later, which age group are we talking about?
Well, usually you'd probably somebody in their 50s and like 50, or later 52, 53.
So if because when I'm reading like between 45 and 55, you would say, so if it happens before 45, you would say it's early
Well, yes, you then say it's early menopause, yes.
And usually, how long does this period last, this period of menopause? Right.
So it varies from individual to individual.
Okay.
Sometimes it can vary between 3 to 5 years.
Okay.
In most cases, sometimes it can go up to about 7 years, but it just depends.
So you're talking about, you said ethnicity. It depends on ethnicity,
socioeconomic status,
right.
And race as well.
Okay.
Sometimes you find out that people in different parts of people, like African Americans and Asians and whites, would experience it a little bit earlier, differently. Yeah.
Okay. So now we've talked about, well, kind of hinted at the different age groups.
Yeah.
But which particular age group do you think it happens with regards to statistics? Like X amount of people would go through menopause at which particular age group?
That's quite hard to say because it's retrospective, the diagnosis. What that means is you're looking back and saying, I haven't had a period for 12 months. So it's quite hard. And some people might not have a womb because they've had a hysterectomy, the womb's been removed because for certain reasons like medical causes. So they would not know that they've actually gone through menopause. And sometimes, yes, exactly. Or sometimes the only way they probably would know is the symptoms that they get, and they go to the doctor for it and explain what the symptoms are. And the doctor might say, it's probably likely you've gone through or you're going through the menopause. So, yeah.
Very good point. So there are two ways in which this can occur, right?
Yes.
So when we're talking about menopause, as we've discussed, it means that there's a decline in the reproductive capability of the woman. Yeah. So there are two ways in which this can happen. So let's go through those.
So you've got the natural menopause, which a woman, basically you have your ovaries, you have your ovary and you've got the eggs in the ovary. So when you're born, you have a finite, fixed number of eggs. And every time you have a period.
So let's just go over that. You're talking about ovaries. I know people who've been watching this show, we've shown pictures.
Yes.
So the ovaries are what produce the eggs that we release every month. Yeah. Okay, go ahead.
And you release these eggs, and every month, if you're not pregnant, the egg, you shed the lining of the womb and you get a period. Right. So that's what normally happens. Right. And so every month you lose an egg or you lose a couple of eggs, and eventually you get to the age where the eggs are becoming depleted, and eventually the eggs, you don't have any eggs any longer, and that's what menopause is all about. So
in terms of
that's the natural form of menopause.
And then the other?
Then the other one is induced. So sometimes people can have induced menopause because they've had treatment. For example, if they had chemotherapy, that would cause menopause.
What is chemotherapy?
So chemotherapy is a chemical that people get. Treatment, medicines. It's a medicine, but it's chemical into your body to treat for diseases like cancer.
Right. Yeah. So when you've had those medications, there's a higher chance of your what should I say? The number of eggs to be reduced, right?
Or damage to the ovaries. So sometimes they freeze the eggs if you've never had a child and that stuff.
Okay. Yeah. Good. So now let's talk about the signs and the symptoms, because we've just mentioned that, yes, it means that you should have had no periods for up to 12 months before we can say that you are going through menopause. So it's important that we discuss these signs and these symptoms that these patients may present with. So let's just go through those. Okay.
I don't know whether you mind me saying that before this happens where you don't have any period, you sort of, what happens, people have what we call the perimenopausal period.
So around
when their period eventually stops. Right. And during that period, they get erratic bleeding. What that means is you might get a period this month, and then 2 months after you get another period, and then 3 months after, and so on and so forth. And sometimes that can last up to 5 years before you eventually have no periods after that. Right.
No, we're talking about
signs and symptoms. Well, during that period, most women would get hot flushes as well. So you get physical symptoms, you get psychological symptoms, and you get sexual symptoms. Right. The physical symptoms, the most important one is the sweating, the hot sweats and the night sweats, or hot flushes or flashes, some people refer it to. And when they sweat for like 3-4 seconds, and then it stops, and then again, they feel this awful feeling, the heat in their body and stuff like that. Okay. Most people would have very mild symptoms of that, but in about in about 10-15% of women that have very severe symptoms of hot flushes.
So that's a good point for you to come, for you to say, because it doesn't, all of these symptoms that we will be talking about, they do not occur in every person.
No.
And they occur with varying severity,
That's
as
right.
you've just highlighted. So you've talked about the hot flushes.
Yes.
I think that's the most common.
Yes, that's right.
When we talk about menopausal symptoms. It's important that we also include the fact that now a woman can be in an air-conditioned place and then she starts sweating, right? And then she might be sitting down somewhere, everybody else is nice and cool, and then there's certain like heat all over her body. That's good to mention. The night sweats you've mentioned as well. What, palpitations?
Yeah, so people can get palpitations, poor sleep, and those are the joint pains. And women who have migraines, they notice that they have increased migraines around that time when they're going through the change, which we normally refer to as the perimenopausal period. And then we also talked about the psychological symptoms. So these people can be quite irritable, low mood, depression, anxiety, and the sexual symptoms as well. That's quite important. So women can have low sexual urge and sexual drive, which can sometimes affect their relationships, and sometimes can have dry vagina, and sex can be quite painful as well.
Thank you. So with regards to, you're talking about psychological issues. So it's important that we also mention that these women have a tendency of forgetting.
Oh yes, they can be quite forgetful.
Yeah, they can be. Yes,
you get people coming in and saying, "Could you check my memory because I think I've lost."
Yeah, exactly.
I'm probably becoming demented. But seriously, can be quite distressing for women, because these women are. At that age, they might be high-functioning women in very good jobs. And they've got huge responsibility, and having to be that forgetful. They feel quite confused, and
and especially where there's little or no information, if you don't understand what's happening within your body or where to seek advice, this might be a trying time. And importantly, you've mentioned sexual dysfunction when it comes to menopause. I think that's also one subject that we do not discuss. Now you're talking about vaginal dryness, which is very important. The hormones, as Dr. Williams has mentioned, the hormones that are reduced during menopause are very important for, what should I say, a healthy sexual life.
And sex is quite important in a relationship, so it's nothing to, you can't downplay that. So,
you can't down. And we're talking about low libido as well, low sex drive, as you've mentioned. But these can happen in the early part of menopause. As we go further along during the menopausal period, you also might have other things like urinary infection.
Yes, you can get late symptoms. So the most common late symptom that people get is the genital urinary symptoms, where people get things like urinary discomfort, urinary incontinence. Some women get prolapse and all that stuff. It gives them urinary. Basically, what prolapse means is just the womb and sometimes the bladder has moved from where it's meant to be and so just gone down. Yes, it's just dropped down usually, and that can cause a lot of problems with urine infections, because the urine, you're not able to pass all the urine out. So you're quite predisposed to urine infections, and also you get a lot of vaginal dryness, as was said before, and a lot of discomfort.
Thank you. I think it's important to mention the whole, what's the main thing about the whole topic is we're going to talk about the importance of these hormones or these chemicals within our bodies that regulate our natural and normal function. So all of these symptoms that Dr. Williams has mentioned, they basically come about as a result of reduced hormonal level that occur in these women. And like we've said, we want to be able to highlight this condition so that if a woman is sitting there at home within that age bracket that we've mentioned and is going through these symptoms, she can, know that one, she's not alone, and then make sure she goes to her practitioner so that she seeks better advice. Well, viewers, you've been watching, this is The Woman's Place, live on AYV Television, Channel 33. I am here with Dr. Ima Williams, a GP from Newcastle upon Tyne, right? Yeah, I have to keep saying that. She also has a master's in aging. That's why we're discussing this subject with her. We are currently taking your questions on the Facebook page, AYV's Facebook page, and also the Woman's Place Facebook page. We are going to take a short break, and we'll be right back after this message to continue the conversation. welcome back to the Woman's Place on channel 33 AYV television. I am here with Dr. Ima Williams, a GP from the UK. We've been discussing the topic of menopause, which is a period that signifies the end of a woman's reproductive life. We are going to continue the conversation, Dr. Williams.
Yes.
So now I know we pay a lot of attention to women's health, obviously, on the show, but obviously we have our male counterparts.
Yes.
And as we've been discussing menopause and all these challenges that women go through, there is some sort of a male-oriented menopause called andropause. Can we kindly just go over that a bit? What does it mean?
Okay. So basically, andropause, there's some set of group of experts who feel that it's something that should be talked about because these men between the ages about 45 to 50 would experience a low testosterone. So testosterone is a male hormone.
Right.
And that so when the testosterone is low, they then have symptoms such as low libido, sexual libido.
So let's just go back. You've mentioned that testosterone is a male hormone.
Yes.
Responsible for what? I mean, I think if we know what it does, so we know that when it reduces, you know, XYZ symptoms would occur.
Right.
So it's responsible for what's usually in a man.
So it's responsible mainly for the sexual drive of a man, the way the man looks, the physical the physical appearance of a man. That's what testosterone does. It also can, if it's low, can affect people's mood and also their energy levels as well.
Yes. So when we have this andropause, certain symptoms that a man will present with, you've mentioned low sex drive, but also mood swings, right?
Yes.
I know we've mentioned mood swings when it comes to women. You will be at home and then for whatever reason, a nice, calm, you know, woman would then start shouting. So the same can occur in males as well, right? And then you've mentioned, lack of enthusiasm or energy as well. That usually happens. Poor concentration and loss of memory. So basically, these same things that we're discussing in menopause also occur in andropause, right?
It does.
Yes, but then this man between the age of 45, 50 may be also going through other stresses in life.
Yeah, that's right.
So it's not always about hormones, is it?
It's not always about hormones because some men when they get to that age, they might lose their job, so their self-confidence is affected, can affect their mood, financial pressures, you know, societal pressures as well. So those things can also cause finances and changes in their work can also interfere with the way they feel.
Exactly, that's a good point. I mean, because there are varying opinions, I should say, as to what causes that male kind of menopause. So a man who is struggling financially or who has work stress, it's also possible that there might be other things that are responsible for that.
Yeah, they might have other factors. And I think with the andropause thing, it's a new concept at the moment, and it's something that probably more robust research is needed to confirm that it happens. A large population of men experience it, and also treatment for.
But I think that the most important thing is if you're having those symptoms, if you're within that age group, it's good that, again, as we're saying for the women, you talk to your doctor so that they see how best to help you. That's the general message, right? Okay, so now let's go back to you wanted to say something.
I was just saying that the problem with some men is they find it quite hard to go to their doctors.
That's a good point.
Yes, they feel very embarrassed.
That's a good point. It's not only an African problem,
no,
right?
it is always. They normally say, oh, I wish he was a male doctor. So if they come in and he's a female doctor, that's the first thing they'll say. But because they're quite embarrassed talking about the way they feel, so especially the sexual libido, if that's low.
If that's the problem, they would prefer a male practitioner. That's a very good point. So let's go back to the menopause, which is what we're talking about, you know, the woman's what should I say, climacteric. So now how do we diagnose this? How do we make that diagnosis?
I think one thing I would want to come to before I answer that question, if you don't mind, is the reason why women feel this way is because of the low hormone, the chemical estrogen. So I think
let's say the name estrogen.
Right? So because we've mentioned testosterone, and I think we should
that's the
really
female hormone.
the female hormone that makes us function as a woman. So the question was
the question is, how do we make the diagnosis of menopause?
Right. Yeah. As I said before, it's a clinical diagnosis mostly. So basically, it's the history. The woman comes in, the woman tells you, I've not had my periods for 5 months, or I'm sweating a lot, or I haven't had my period for a year. So it's from the history, what they tell you, that you make the diagnosis. Usually, we should only do a test. So there's a blood test that you can do, but that blood test probably you would only do that if you're in doubt, if you feel that I'm not quite sure whether this woman is definitely going through the menopause. Is she too young to go through the menopause? If she was less than 40, and
yes, then you would start thinking about other things, right?
Yes,
you would start thinking about other things. Yes.
So you then want to do the blood test, which is the FSH, follicular stimulating hormone, which is just a blood test that you do, and you do it 6 weeks apart. If one is negative, if one is positive, then 6 weeks you do a second one just to confirm the diagnosis.
Okay. So basically, it's more about what the woman presents with, and then later on, whatever blood test you would do. But it's good that we're in touch with our bodies, so we know what the norm is, and so we know when something is going wrong and what to tell our doctors. So that's a good point. So when it comes to managing this condition, because we've mentioned that it's a period, it's a phase.
It is.
You go on the other end of it, right?
You do.
So how do we then manage these women?
Right. So first and foremost, listen to the woman who comes in and tells you these things. I mean, sometimes because the man might be, oh, I think I'm losing my mind, and then all this is going on. Just listen. Sometimes compassion, just listening to what they have to say. The other thing is, we have non-medical and medical treatment for the menopause, and when people are going through that. So the non-medical things are lifestyle changes. So lifestyle changes includes, if you smoke, try and reduce or stop.
Or stop.
Okay? Ideally stop.
Okay.
But alcohol, manage the quantity of alcohol you drink. Sometimes spicy food can make people have more hot flushes. So reducing how spicy the food is can sometimes help.
On the environment that you're in, if it's hot. I mean, we live in the tropics.
Oh yes.
So don't you think that also?
That does, So wear sensible clothes, wear cotton clothes, loose clothing, because that helps to cool you down a lot more than tight clothing. Also, things like exercise. I think women, we need to take good care of ourselves. We need to find time. I know we're busy and we're mothers and everything else, and wives and sisters and everything you can imagine. But one thing I normally tell women, you have to put yourself first sometimes, and you have to look after yourself and do exercise, because it does help. Weight management, losing weight can help. So those things that I've mentioned can help. Those are the non-medical
But also, if you drink lots of coffee, it's good that you reduce your caffeine intake. It's also good that you reduce alcohol intake in terms of non-medical treatment. So you see, as with some medical conditions, just what you do as an individual goes a long way before medication comes in, right? So on the other side, now there are medications that you can give. Let's discuss that a bit.
So the widely used treatment for menopause and menopausal symptoms is the HRT, the hormone replacement therapy, which is replacing the chemical that the woman has lost. So if the woman has lost the estrogen, because the ovaries which produce the estrogen is depleted. So because that estrogen is not there, the woman feels the way she feels, and then you're using something to replace the estrogen that they have lost to help them feel much better.
So it's as if nothing was ever taken away, so to speak.
Yes, that's kind of the. There's a lot of controversy about the HRT, but it's still the best thing we've got in the market.
So it wouldn't be used for everybody. So it's on a patient by patient basis, depending on you and your doctor and what you decide, or what he or she decides. Well, basically, I think it's what you guys decide is best for you. So that would be the best thing. So all of these things that we've mentioned regards to reduction of estrogen, the HRT or the estrogen replacement, aims to reverse.
Yes,
right?
that's right.
So you would have like better memory.
Yes,
Let's
so
talk about
people,
how it would help.
Yeah, so people would come in when you give them HRT, they're different women altogether.
Right.
Their lives changed because the symptoms that they have, the hot flushes, the things that wake them up, these women are tired. If you're having a severe hot flush, where some people do, or prolonged hot flush, because unfortunately 10% of women would go on to have hot flushes for about 15 years of their lives.
That's a good point, because it's, I mean, I did say that it's a phase that you go through and you come on the other side, but then the duration varies for different people.
Exactly.
So I was trying to be optimistic,
yes,
but now you just said
but
10%.
no, but 10% would have very severe and prolonged hot flushes. You know, that woman can't sleep, that woman can concentrate, she's always hot and cold and miserable, and HRT changes their lives.
Yes.
You know, the forgetfulness, not knowing where things are, that changes. So the woman comes in feeling renewed and revitalized and re-energized and feeling that they can go on. You give them hope. So that's what the HRT does.
And also, when we talk about menopause, we talk about, what should I say? The minerals that help us build our bones. That's also an issue that older women have.
Yes.
So HRT is also important.
So it helps with osteoporosis as well. It helps with cardiovascular diseases, because the thing is, when as a woman, when you lose this estrogen because the ovaries are not working, your risk of having heart disease increases as well. So the HRT would improve or reduce the risk of heart disease. But you have to look at the other side, look after the other things as well. Like
so now, good. You're about to touch on that. I mean, there are so many. It's a good thing. You can use it, but also there are complications. Yes, there are. So that is why it's not something that's to be taken lightly. It's something that you can only use after thorough deliberations between you and your doctor. So what are possible complications when you're using HRT? Right.
So the most renowned complication of HRT is the risk of having breast cancer. However, when you go to the doctor, it's a case-by-case discussion. It's a case-by-case decision as who would have HRT. There's something else that you can have, not as good as HRT, which is called Tibolone.
Yes,
but, but usually that is only for people who have actually gone through the menopause. But people who are going through the hot flushes, we're going to not having a period altogether when they're going through this perimenopausal period. These women, because of the hot flushes and the other symptoms that I've mentioned earlier, these women would benefit from the having the HRT. So that's the most common.
So there are side effects. Exactly. So there are side effects. So it's to be used with caution, for sure. So Dr. Williams, now, as a woman living in a house going through menopause, maybe you have a husband or a partner, you have your children. What are their roles?
Okay. I think the main thing that partners need to do is, if you feel that your wife or your partner is going through something like this and you suspect that they might be going through the change, as some people would call it, encourage them to see their doctors. Because, because then one is so you know what you're dealing with. Right. And secondly, you know that there's somebody there who's an expert who would give the woman the advice and support that she requires. And then the other thing, you yourself as a partner can educate yourself. What is menopause?
I think that's a very good point. You won't be able to support fully if you don't know what the situation is. Very good.
Yeah. And as Dr. Sise has said, I don't know if I'm allowed to say Dr. Sise, and what she said earlier on is that it's a phase and you would pass. But during that period, it can be quite, it can affect relationship quite detrimentally. So the partner being educated is quite a good thing. The other thing is, try to be flexible as a partner. Sometimes remember this woman is going through a difficult time. She's grieving because she's losing her reproduction.
Right.
She's not going to have babies anymore.
Not naturally, at
naturally,
least.
yes. Yeah,
Not
that's
naturally,
right.
at least.
Yeah,
yes.
yeah. But you know, she's grieving. She's losing something. Even if she doesn't want to have a baby because she's had all her children, she's becoming. She's a different woman. Her body's changing. She's probably losing her confidence in the way she looks.
Exactly.
So give the woman
and sexual desires.
Yes, yeah.
And I think especially for a society like ours, where childbearing is such an important aspect in the society, having a woman go through this condition and knowing what it means, you really depend on strong and compassionate partners and family. So for sure. And then what about the children?
I think they're just understanding as well. Sometimes mom is not in the mood to joke with you or laugh with you or be the same. She's going through a tough time.
Or try to be understanding with the mood swings. She might be there with you talking and laughing and then something comes up and then she completely changes. Just be understanding with that, right?
It's just support and understanding.
And I think the same advice for practitioners.
Yes, it is. Yes, yeah. I mean, it's just being supportive, really, and that's the main thing. Education space, give the woman space. If she's not in the mood as a man, you've had plans and she doesn't feel like going, that's fine. Okay, honey, you go. We can do it another day.
So now now we've talked about the partner or the children.
Yeah.
So now let's talk about the woman herself.
Yeah.
How, now that she's equipped with information, she's sought the advice of her doctor. They've discussed it. They know what the diagnosis is. They've made a decision as to what medication or what lifestyle changes to take. Now, what advice as a GP, like with regards to your patients? I mean, I know we've talked about wear light clothing and make sure you keep the room cool and all that. How does she live through this for whatever period it takes? We've also mentioned that it varies. So we're not giving false hope and saying, in a year or two it'll be fine, because we don't know person. So what are we telling this woman?
So we're telling this woman that this is a phase and it would get better. There are some things that would help depending on whether she fits the criteria to have the medications if they're available. This woman also has to be, and the problem is the uncertainty around menopause, because sometimes you think, how long is this going to go on for? I don't think anybody has the answer to that. We sort of have a rough idea of how long. It could be 3 to 5 years. Unfortunately, as I said, some people would go on to have it for 15 years, 10% of women. But during that period, it's just being optimistic. Being optimistic, and information is power. Knowing what you're dealing with. You've spoken to your doctor, you've read about menopause. There are good websites that people can go to and read about menopause. Everybody's got access to internet these days and read about. So that can help. And also doing things within your power to help you to go through this difficulties. The other thing is, I think people need to be a little bit more open and talk to other people who've gone through it. Share your experiences. Women, we need to speak to each other. There's nothing to be embarrassed about. Every woman over the age of 60 would have gone through menopause.
So there's something to learn from those who have gone through it.
So you could ask them, like, how did you go through yours?
What helped you?
Yes, exactly. what helped
you?
And you could try it, and if it doesn't, somebody else might say, oh, that helped. And that kind of thing. And we need to learn from each other. And I think that's some of the things that we miss.
A valid point. Some sort of like a peer group. Supports group, I should say.
I mean, people should, sometimes you even speak to your mothers. Your mothers would know, because your mothers have gone through menopause. And most of the time, the maternal menopause sort of reflects on the children. So the age that the mother goes through menopause would almost be the same age that the daughter goes through menopause. So speaking to your mother about it and asking them, how did they go through, how was it for you, mom? And getting that experience as well.
That's a good point. Just to be open and have free conversations about it. Well, we've discussed a lot with regards to menopause, but now I kind of want to just give you a last word. Just give us a summary. Draw back on your experience with all the patients that you've seen and how they've been able to go through it. Kind of give us your last word.
So menopause is, we can try to make it a positive experience, and also speak to your doctor as well. They might have useful information and people who might be willing to share their experiences with you as well. And also look after yourself, do exercises, reduce alcohol and smoking, or stop smoking altogether, and try to lose weight. And hopefully, you know, and knowing that not everyone suffer from very severe symptoms.
Menopause, and yeah, so it's different. So what your friend says per se
might not be the same thing for you.
Exactly. Thank you very much. Well, viewers, you've been watching The Woman's Place live on channel 33 AYV television. Just as a background, the World Health Organization projects a rise in the proportion of adults over the age of 60 in sub-Saharan Africa from 46 million to about 157 million by the year 2050. Now, due to this growing aging population and longer life expectancies, more women will now go through menopause and enter the postmenopausal phase of their lives. As we focus on maternal and adolescent health, some of our attention should also be on menopausal health in order for us to be able to cater to this growing population. We need to educate women on what's happening with their bodies and also engage their partners and their family members so that they have the support that they need to go through this trying period in their lives. I'd like to thank my guest, Dr. Ima Williams, for helping us navigate through this subject. Many thanks to the team here at AYV, and then thanks to you viewers for joining us this evening. Till next time, I've been your host, Dr. Frances Ramatuwuri Sise, wishing you all a happy and a healthy weekend.
You're watching AYV Television.